Hello, welcome to The Wild Show. This is a podcast done by people with learning disabilities for people with learning disabilities. My name is Emily and I'm joined here with my two guests. So our second topic is pregnancy. What is pregnancy?
Okay. So that's when a sperm from a man fertilizes an egg within the female, and that causes then a baby to grow. And that usually takes around 9 months.
What effects does it have on the body?
And there's lots of different effects, and not some people have them and some people don't, so it can be different for for different people. But the common effects really are having aches and pains, possibly in your lower tummy and in your joints as well. Morning sickness is also quite common, so that can be feeling sick or actually being sick. And although it's called morning sickness, it doesn't just happen in the morning. It can be sort of any time of the day, really. Being constipated, so not being able to go to the toilet properly, is another common side effect. Having cravings for certain foods. So sometimes women, they really crave sort of perhaps unusual foods like ginger biscuits or garlic. But sometimes people go off food as well, so that can, maybe the smell of a certain food can make you feel sick, and set off that morning sickness. Having heartburn and indigestion is also common, but needing to have a wee more often, needing to urinate more often. Having back pain, being tired, so often ladies who are pregnant, will need to sort of take a rest if they can. Vaginal thrush. So thrush is a yeast infection. So it's and it looks like it's sort of like a white discharge, and if you've got that, you might see it, some sort of white discharge in your pants, and it can make your vagina feel very itchy. So that can be quite common because of the hormonal changes when you're pregnant. Your skin can change, and sometimes some people find that their skin, they can get really itchy skin. Hemorrhoids, so sort of sometimes people notice piles, so bleeding from your bottom. So that can be some ladies have that. Having leg cramps, so having pain in your legs, some quite severe pain which lasts for a short while, or having something called restless legs. That means your legs are very twitchy at night, and you find it hard to keep your legs still. Varicose veins, so thin veins that appear mainly on your legs or your knees or your legs. Swelling in your ankles, feet, and your hands. Some ladies experience dizziness or fainting, feeling tired, or just feeling lack of energy. So some people have nasal problems, so problems with their nose, or have problems with their breathing, sort of shortness of breath. And then some ladies, and I think that's fairly common as well, is having sort of their breasts become larger, and they can be quite tender to touch as well, a little bit of discomfort. But as I said earlier, this is a big list, but not everybody has those things, but some people have some of those things.
The next question is, what is postnatal depression?
So postnatal depression is a depression suffered by a mother following childbirth. And that's usually due to a combination of things, really. So hormonal changes within the body, mentally adjusting to motherhood, because it has a huge impact on your life, becoming a mum, especially for the first time. And that coupled with tiredness, extreme tiredness, babies don't sleep at night generally. So lots of mums are up during the night for several hours, feeding and things like that. So a combination of all of those things really can sometimes cause the mum to develop something called postnatal depression. And that's not every mum, that's, just occasionally,
Are there any other postnatal conditions?
So there are quite a few that we've looked into. And again, this is just, some of this is going to sound a little bit scary, a little bit frightening, but these are quite rare. So I don't want anyone to feel like frightened by any of this about what I'm going to say, but some of the conditions that you can develop following having a baby are cardiovascular diseases. So there's something called cardiomyopathy, which is a weakness of the heart muscle, and that can lead to heart failure and obviously be deadly. There's also a chance or a risk of infection or sepsis. I'm not sure if you know what sepsis is.
Blood poisoning.
Yeah, that's right. So, and that particular infection or blood infection is extremely dangerous, and it can make someone very poorly very quickly. So that's definitely something to be mindful of. Also, following giving birth, it is quite natural to bleed for a few days, sometimes a couple of weeks after birth. However, some mums may experience some difficulties with that, and they may find that they get excessive bleeding and may start passing clots and things, and that would be something that you would need to seek urgent medical attention for. Sometimes also there can be blockages in one of the arteries in the lungs, which can often be caused by blood clots in the legs, because perhaps, you know, maybe the mum hasn't been too well towards the end of the pregnancy and hasn't been as mobile as perhaps they once were. So sometimes in hospital you get given fancy stockings to wear to help keep your veins and things healthy and things like that. There's also a chance of stroke, and that's usually because potentially the mum may have suffered with high blood pressure during pregnancy, or sometimes changes within the body, you know, whilst giving birth can increase blood pressure as well. And very, very rarely, you can also get complications from something called preeclampsia. And that's a disorder really of the body which is related to your blood pressure. So it can cause extremely high blood pressure within the body. It also causes your liver and your enzymes within your liver to increase, and it also means that you have a low blood platelet count. So all of those things combined can put a huge strain on the body and cause your organs inside to start shutting down, which can be very, very serious for both, well, mum and baby, because you can develop HELLP syndrome within, you know, whilst you're pregnant as well. And then there's also a chance that you can develop other mental health issues. So mum might experience increased anxiety or something called obsessive compulsive disorder, or OCD. You may have heard of that. Sometimes also mum can experience psychosis, so she might well be hearing voices telling her to do certain things, or she might be seeing certain things, misinterpreting situations, that kind of thing. And unfortunately, sometimes that does lead to thoughts of harm either to herself, or she may feel like she wants to harm the baby. But again, these are all very rare, but things to be mindful of.